Greetings. Welcome to my podcast, and thank you for tuning in. I'm Dr. Andrea Walker, family nurse practitioner, IFBB professional bodybuilder, fitness guru, weight loss specialist, personal trainer, and owner of Dr. Andrea's Medical and Weight Loss Clinic located in Cordova, Tennessee, as well as the owner of Telehealth DNP, where I treat patients throughout the states of Florida and Arizona via telemedicine. In today's episode, I will discuss the basics of Semaglutide, Wegovy, and Ozempic. If you listened to my first podcast, I discussed the basics of compounding pharmacies, and I touched a little on compounded Semaglutide, as well as tirzepatide. I will discuss tirzepatide, Zepbound, and Mounjaro next week, but the focus this week is on Semaglutide, which is the generic name for Wegovy and Ozempic. So let's get started. How did Semaglutide, Wegovy, and Ozempic come about? The FDA approved Ozempic, whose generic name is Semaglutide, in late 2017 for the treatment of type 2 diabetes. The manufacturer of the drug is Novo Nordisk. What PCPs found out quickly was that a lot of their diabetic patients were losing weight while taking it, so that's why many people now continue to call Ozempic a weight loss injection, but the weight loss is truly a side effect and welcome benefit for diabetics. However, this led to a huge increase in prescribing the medication for both diabetics and non-diabetics, causing the shortage, which is still going on today. A lot of people are not aware of this, but in 2019, an oral form of semaglutide called Rybelsus was approved for use in the United States for type 2 diabetics. I won't discuss Rybelsus any further, but I just wanted to put that information out there. It is basically the oral form of Ozempic and is designed to be taken orally every day. Moving on. In the meantime, while COVID was going on but wrapping up, the same manufacturer of Ozempic came out with the medication Wegovy, whose main ingredient is also semaglutide, but the indication for use was different. Wegovy was FDA approved for chronic weight loss in June 2021. Wegovy was designed to be one of the first injectable medications for chronic weight loss. This made it possible in 2021 for non-diabetics to reap the benefits of semaglutide and not have to request a prescription for Ozempic, leaving those prescriptions for true diabetics and or for those with prediabetes. Around the same time that Wegovy was approved, compounding pharmacies were given approval by the FDA to compound semaglutide as well because a shortage remained. This was due to the fact that both Ozempic and Wegovy were such a hot commodity. Now, you might be wondering, but how can both Ozempic and Wegovy have the same exact generic name, semaglutide? Well, that is because semaglutide is the main ingredient in both. The dosing is different and the brand names are different, but the main ingredient in both are the same. Ozempic comes in an injectable pen with dosing of 0.5 milligram, 1 milligram, and 2 milligram, while Wegovy comes in an injectable pen as well, but the dosing is 0.25 milligram, 0.5 milligram, 1 milligram, 1.7 milligram, and 2.4 milligrams. So, in essence, Wegovy has more doses and starts lower, but goes higher than Ozempic. Now, let's discuss semaglutide, which would be the compounded version. And just to clarify, I say compounded because although Ozempic and Wegovy's main ingredient is semaglutide, which is also the generic name for both medications, at the time of the recording of this podcast, Novo Nordisk does not actually make a generic version of either product. However, compounding pharmacies and only compounding pharmacies are allowed to make the generic version of Wegovy. So, when you receive a compounded version of semaglutide, it will not come in an injectable pen. However, the medication is still injected subcutaneously in varying amounts. I have seen compounding pharmacies compound semaglutide up to 2.65 milligrams versus Wegovy's max dose of 2.4 milligrams. However, Most healthcare providers will prescribe the compounded versions equivalent to the brand Wegovy, meaning the max dose for the compounded version will also be 2.4 milligrams of semaglutide. Just to explain a bit more, while the medication is dosed in milligrams, you will hear many patients who take the compounded versions discuss it in units. For example, 10 units might be equivalent to 0.25 milligrams, and 96 units might be equivalent to 2.4 milligrams by one particular compounding pharmacy, but another compounding pharmacy may compound their semaglutide so that 5 units equals 0.25 milligrams and 50 units equals 2.4 milligrams. Each compounding pharmacy has their own way of compounding the medication, so not every compounding pharmacy will have the same equation to determine the number of units to inject, and that is perfectly fine, but the amount of milligrams will be what really matters. You basically want to make sure the compounded semaglutide is dosed in the ranges from 0.25 milligrams to 2.4 milligrams, and the number of units the patient injects will be determined by this. I put that out there just in case anyone who might be listening is currently taking the compounded version and comparing their dose with someone else's dose. You really cannot do that when discussing units. This can only be done when discussing milligrams, so please keep that in mind. And just to go a little bit further, for those who may not know or who may be thinking about buying the compounded version, when you receive your vial, it will come with typically insulin syringes. And like I said, your 0.25 milligrams may be equivalent to 10 units. So it's going to tell you to inject 10 units subcutaneously into your abdomen. But say you switch companies and say now 5 units is now equal to 0.25 milligrams. So it's very important to pay attention to how many units you are directed to inject, because that may change from compounding pharmacy to compounding pharmacy, and there's nothing wrong with that. So I hope that makes sense. So moving on, let's discuss how does Ozempic, Wegovy, and semaglutide actually work in the body. In a nutshell, it delays the gastric emptying of your stomach contents, causing you to feel fuller for longer, leading to the intake of less calories, and the medication helps to maintain your blood sugar levels. Both of this aids in the end results of weight loss, but there is so much more to it. Semaglutide is a GLP-1 receptor agonist. You may see it written as GLP-1RA, or just hear it simply called a GLP-1. GLP-1s are a class of medications used to treat diabetes and obesity. GLP stands for glucagon-like peptide 1. But what does that really mean, and what purpose does it serve? GLP is basically a hormone which is released from cells in our intestines. It is a peptide that contains 30 amino acids. This hormone mimics the action of the naturally occurring GLP hormone, which our stomachs release after eating to help the body produce more insulin and lower blood sugar levels. So listen carefully. Our bodies naturally produce the GLP-1 hormone. However, some of us may not have as much production as others. This is where receiving the injectable version can provide benefits to help with those who are lacking in the hormone. So hormones do play a huge role in our bodies when it comes to weight loss. So what you are injecting when you inject, whether it's Ozempic or semaglutide or Wegovy, it is not foreign. You are actually injecting a hormone that mimics the GLP-1 hormone that our bodies actually produce anyway. So with that being said, you may be wondering, but what purpose does the GLP-1 hormone? Why does the shot work so great? I know a lot of people actually call it a miracle shot. I wouldn't go that far, but it does work great for many people. So it has a lot of great benefits, and let's discuss those right now. So the GLP-1 hormone can decrease your appetite. It can increase the feeling of fullness. It can increase insulin sensitivity. It can delay the emptying of your stomach contents, causing you to feel fuller for longer. It can decrease GI motility. It can decrease glucagon secretion, and it even provides some cardiovascular benefits. It can decrease the risk of heart attacks and decrease the risk of cardiovascular disease. So when you take Ozempic, Wegovy, or Semaglutide, these medications act by binding to GLP-1 receptors in your body, resulting in the same benefits that I just mentioned. So with that being said, if your naturally occurring GLP hormone is not working efficiently or effectively, the injections will benefit you all the more. This is one of the reasons why some people have better weight loss results than others. It all has to do with our hormones or lack thereof. So, who qualifies to take these medications? Not everyone will qualify, unfortunately. So we'll start out with Ozempic. To be prescribed Ozempic, you will need to have a diagnosis of diabetes, and in some cases, PCPs will prescribe it for prediabetes. I get a lot of patients who come to my clinic and tell me that their insurance used to cover their prescription for Ozempic, but no longer covers the cost because they do not have a diagnosis of diabetes and they are not pre-diabetic. As mentioned earlier, when Ozempic first came out, many providers were prescribing Ozempic to their patients, both diabetics and non-diabetics, and their patients were reaping the benefits of weight loss. At that time, back in 2018, I was actually traveling around the United States and promoting the weight loss drug Saxenda, which is also a GLP-1 indicated for the use of chronic weight loss and also manufactured by Novo Nordisk. Many of the PCPs told me that insurance would not cover the medication, so they would just put their patients on Victoza, which is also a GLP-1, but indicated for type 2 diabetics. However, it also caused weight loss. Victoza was more likely to be covered than Saxenda at that time. Very much so like Ozempic was more likely to be covered several years ago for both diabetics and non-diabetics. Insurance companies have caught on now, and most will not cover the cost for Ozempic or even Victoza unless you have diabetes or prediabetes. Some insurances will cover the cost for Wegovy for weight loss, but many still will not, which is why a lot of people end up searching for compounding versions of Semaglutide. Now, moving on. The qualifications to receive a prescription for Wegovy or compounded Semaglutide are a little more lenient, but still have requirements. First, I will discuss what qualifies you and then discuss what disqualifies you. You must have a BMI of 30 or greater, which is considered obese. If your BMI is not 30 or greater, then it must be at least 27, and you must have one of the following diagnoses: hypertension, elevated cholesterol, PCOS, type 2 diabetes, or sleep apnea. There may be other diagnoses that will qualify you as well with a BMI between 27 and 30, but those are the most common. Each healthcare provider can determine what other diagnoses are allowable. Now, things that will disqualify you are if you or a close family member have a history of medullary thyroid carcinoma, if you are taking another GLP-1, if you have an endocrine system condition called multiple endocrine neoplasia syndrome type 2, if you are allergic to semaglutide, if you are currently pregnant, or if you have a history of gastroparesis. Now, let's discuss things that may or may not disqualify you, but definitely need to be discussed with your healthcare provider. If you have a history of pancreatitis or problems with your pancreas in the past, if you have a history of kidney problems, if you're currently breastfeeding, if you have type 2 diabetes with a history of diabetic retinopathy, if you have a history of depression, suicidal thoughts, or mental health issues, or if you're taking insulin or sulfonylureas. Again, the ones just mentioned may or may not disqualify you, but more details would need to be discussed between you and your healthcare provider to determine if it's a go or no-go. Now, I will give you a list of all the potential and common side effects. This does not mean you will experience them, but if you do, just know that it would not be a surprise to your healthcare provider, but definitely let them know so that an intervention and guidance can be provided so that it does not get worse or become a serious problem. Nausea, diarrhea, vomiting, constipation, stomach pain, headache, fatigue, upset stomach, dizziness, feeling bloated, belching, low blood sugar in people with type 2 diabetes, passing gas, stomach flu, heartburn, runny nose, or sore throat. The ones that I see that are the most common to the point that they are almost expected are nausea, heartburn, constipation, fatigue, and mild stomach pain. But again, you could experience any of the side effects, or you could be one of the lucky ones and not experience any of those side effects. Now, I'm not trying to scare you, but let's discuss the more serious side effects. You could develop pancreatitis, gallbladder problems, low blood sugar in anyone, but especially those taking insulin or a category of drugs called sulfonylureas. This is why it is super important to make sure you have a good healthcare provider who discusses all of this with you and goes over signs and symptoms to watch out for. Now, these medications contain a black box warning. Wegovy and Ozempic both have these listed on their websites. It reads, important safety information, may cause serious side effects including possible thyroid tumors, including cancer. Stay with me, it gets better. But this is what you should be on the lookout for. Notify your healthcare provider if you get a lump or swelling in your neck, hoarseness, trouble swallowing, or develop shortness of breath. This is where it gets better. Studies were completed on rats, not humans, but rodents, and thyroid tumors did develop in them. I always tell my patients it is not known if GLP-1s will cause the same concerns in humans, but be aware of the previously mentioned symptoms to be on the lookout for. I remember when I attended my training for Saxenda with Novo Nordisk back in 2018, and Saxenda contained the same black box warning. I'll be honest, I was uncomfortable at first when I heard about the thyroid tumors and cancer. I voiced my concern, and I remember the trainer telling me how the studies were completed on rats. He was like, our brains are much different than theirs. It calmed my nerves, and I went on to do my own research. I could not find where a human did develop medullary thyroid carcinoma due to taking a GLP-1. But the black box warning is there, and it's there for all GLP-1s. So, how long should you or can you stay on the GLP-1s? Being that Ozempic is indicated for type 2 diabetes and some take it for prediabetes, you can remain on this medication indefinitely. This is a decision that needs to be made between you and your healthcare provider. Of course, your blood sugar and A1C will be key indicators as to dosage adjustment and discontinuation. As for Wegovy and Semaglutide, when it comes to weight loss, because it is indicated for chronic weight loss, there really is not a time frame that one must come off the injections. It really is individualized as well. For example, is the patient able to tolerate the side effects? Is the medication even effective? Now, at my clinic, all patients remain on the lowest dose of semaglutide, which is 0.25 milligrams, for at least 4 weeks. They have the option to increase to the next dose every 4 weeks until they reach the max dose of 2.4 milligrams, but only if they are tolerating the side effects and not missing any of their weekly doses. Some patients will do great at lower doses and remain there for weeks or even months at a time, which is a great choice. It's like the old saying goes, if it's not broke, then it doesn't need to be fixed. But on the flip side, there are patients that will want to either remain at a low dose for weeks at a time or come in randomly, but then complain that they are not losing weight. Well, the medication was designed so that you could increase every 4 weeks if needed and as tolerated, and meant to be taken weekly until maintenance dose was achieved. GLP-1s were not meant to be taken as needed unless you are at maintenance dose, nor were they designed to remain on the lowest dose for months at a time without losing weight, if weight loss was the goal. Meaning, it is perfectly fine to increase according to your healthcare provider's recommendations. Now, on the flip side of that, many patients want to rush and get to the highest dose as quick as possible. This is absolutely not a good idea and will not be allowed at my clinic. This can lead to increased side effects such as gallbladder problems, hair loss, pancreatitis, or kidney problems, just to name a few. Therefore, slow and steady will be the key to your success. People ask me all the time, how much weight can I expect to lose in a week or a month? In my clinic, I have seen as much as 14 pounds lost on compounded semaglutide in the first week. Now, with moderate weight loss in the first week, I typically do not see that same amount of weight loss by the same patient on a weekly basis, and that is a good thing. While some may want to lose a lot of weight quickly, I do not want to see that and will not allow it. I have never had to deny a patient an increase in dose or deny them receiving the actual injection on a weekly basis due to losing weight too quickly, but I would deny them if I needed to. It just so works out that patients do not lose 14 pounds every week. And again, that is the most significant weight loss I have seen in my clinic in the first week. It's never every single patient or even most of my patients. But if I can be honest, a lot of patients who lose a lot of weight in the first week, it's usually due to a shock to their body. They are eating way less or they have cut out a lot of the junk food, which caused a significant decrease in weight the first week. Now, as far as a more realistic weight loss, I generally see 2 to 4 pounds dropped weekly in my patients taking compounded semaglutide. I highly stress eating healthy, working out, and increasing water intake to aid in their weight loss success. I will go a little deeper into how long a person can remain on the weight loss injections. Some of my patients have been on compounded semaglutide for 6 months and reached their goal weight, whereas others took up to a year to reach their goal weight, but most continued with maintenance injections afterwards. They now receive the injections once every 3 to 6 weeks to help maintain their goal weight. Now, I want to briefly address this. Making lifestyle changes versus not making lifestyle changes while taking the weight loss shots. Like I said in my first podcast, I wanted to start this podcast because there is so much misinformation out there floating around on social media. Let me make this clear. Everything does not work for everyone, and everything does not work the same way for everyone. Some people can eat terrible and still lose weight, while others have to eat super healthy and work out to reap the benefits. Many will fall somewhere in between the two scenarios. Whatever the case, just make sure to run your own race and focus on you. It's you against you. While yes, there are people who can still eat terrible and the weight will just fall off, those are also the ones who will definitely have to be on the shot indefinitely. Otherwise, their weight will come back fast, and it is a good chance they will gain even more weight than what they weighed when they initially started. I realize some people want to take the shots for short-term use as well. But for those doing that, don't be surprised if you do not make a lifestyle change and you gain your weight quickly once you stop the injections. This is actually true for everyone, regardless of short-term versus long-term use. I always stress to my patients that your weight loss is a lifestyle change and journey. You don't just reach your goal weight and that's it. You have to develop true lifestyle changes to maintain. Some people will be able to come off of the injections completely and keep the weight off. Others will have to have maintenance injections to keep the weight off. But many will simply put their weight back on once they stop the injections if a true lifestyle change with good habits have not been developed. Being on the weight loss injections is the perfect time to make those changes. Make healthier eating choices, drink your water, and get in some exercise. I cannot stress that enough. Finally, please stop believing everything you read and hear on social media. I saw where a person said that one of the brand injectables almost killed her and she was never going to take it again. She said she was in the hospital and her kidneys had shut down and she had had problems with her pancreas. For entertainment purposes, I read the comments. People were commenting how you should not go to a medical spa or a weight loss clinic and get your weight loss medications, but you should always go to your PCP's office. Others were saying things that were not true as well. As I looked at the picture of the medication she posted and had taken, it was the brand name and it was also the highest dose of the medication. Just so you know, you cannot pick up the brand name of Ozempic or Wegovy at a medical spa or a weight loss clinic, but you can only pick it up at a retail pharmacy such as Walgreens or Walmart, and it is generally prescribed by your PCP. In addition to that, you should never start at the highest dose. As I mentioned earlier, always start at the lowest dose and titrate up. Unfortunately, that's one way to shut down your kidneys, develop pancreatitis, or end up in the ER as she did. I have seen people selling their brand Ozempic and Wegovy on social media. I know people often take other people's medications. That's another way to end up in the emergency room as well. So please do not do that. These medications work great when you are assessed by a qualified and licensed NP, PA, or MD, but they do not work so great when you're managing your own care. So for those doing that, please stop it for your own health and safety. Lastly, I will give you some tips to help you be successful while taking Wegovy or Semaglutide. Eat your protein. Protein is your friend. Take a fiber supplement daily and increase your green veggies. Eat healthy fats such as almonds, avocado, and salmon, but all in moderation. Take a multivitamin and consider taking a hair, nail, and skin vitamin. Drink your water. Half a gallon is a great start if you are not a water drinker, but more is better, in my opinion, if it is not contraindicated. And make sure to drink your water throughout the day. There is such a thing as water toxicity, so do not try to drink too much too fast. Make sure you're exercising. Lower your carbs. It doesn't need to be like a keto carb diet, but just watch your carbs. Try to eliminate the sweets and eat the healthy carbs. And then finally, do not give up just because the scale does not move every week. Sometimes it might be inches that you're losing. As I wrap up this episode, this list is just a few tips to help you be successful. There is so much more to discuss, and I will get around to it. I hope you enjoyed today's podcast. Have a great week. Eat a healthy diet, exercise, and remember, it's a journey and lifestyle change that you're making. You can do it.